this week, and we wanted to take this opportunity to honor and celebrate this group of individuals who significantly contribute to our community. For additional resources on Hispanic Heritage Month, we encourage you to follow our friends at Centro Hispano, the Latino Task Force, and Hola Hora Latina. These are just a few of the several organizations in our community recognizing and celebrating our diverse community. Our real life example of how to put the 5 core actions into play is watching a sporting event on TV with friends. Professional and collegiate sports are underway across the country, and you likely want to see it with some friends. And that's fine. We just want to make sure you're doing it in a safe way. If you are having people over to your house, limit the number of people you invite to ensure that you can properly physically distance between the folks that are coming over. Before folks arrive, you can even space out your furniture so that they're set separately so that there's at least 6 feet of distance between households. If 6 feet isn't possible, wearing a mask is strongly advised. We have seen some folks set up driveway watch parties. That way people are able to watch the game, but also stay outside where it's easier to physically distance. And that's a great idea. Encourage folks to bring their own food or pre-plate individual portions if you're providing it, so there isn't a lot of congregating around the food station. Make sure to clean and disinfect commonly touched items regularly and encourage everyone to wash their hands often. Those are just a few simple ways that you can keep yourself and those around you safe, while also going about your life and having fun with your family and friends. We are continuing to test today and tomorrow at the Jacob Building from 9 a.m. to 3 p.m. Next week, we will test Monday through Thursday at the Jacob Building, also from 9 a.m. to 3 p.m. As a reminder, the Board of Health met last night, and their next meeting is scheduled next Wednesday at 5 p.m. We'll now move into the local situation. We have 151 new confirmed cases since yesterday's report, giving us 8,807 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 336 probable cases. 6,892 of our cases are considered inactive, giving us 2,183 active cases. 320 individuals have been hospitalized at some point in their illness, and 34 Knox County residents are currently hospitalized. Unfortunately, we have 1 additional death to report today, bringing our total to 68. And now we'll transition to the benchmarks. As a reminder, for the majority of our benchmarks, what we want to see is no 3-day statistically significant shifts within a 2-week time period. Every day we look back at the previous 2 weeks. That's what a rolling average is. Overall, what we mean by this is we are trying to see, are things getting better, staying the same, or are they getting worse? And if so, how much better or worse, and at what rate? As a reminder, all of this data that we are going to talk about is on our website. You can find it at covid.knoxcountytn.gov/case-count. Moving on to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the growth rate over time. Last week, we saw 5 consecutive red flags. This week, we have seen 2 red flags. All of this indicates a statistically significant increase in cases, but because of this, we are representing this benchmark as red. The majority of new cases we are seeing continue to be in the 11 to 20 and 21 to 30 age groups. As school is now well underway, this further stresses the importance of following the 5 core actions in every situation. Students, families, teachers, and administrators at all levels, from elementary school through colleges and universities, need to make sure they are following these core actions not only inside the classroom, but outside the classroom as well. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. For this benchmark, we are utilizing 2 bar graphs, one that shows a sample of the tests conducted for Knox County residents and another for average time between specimen collection and lab report data. Over the 14-day evaluation period, we did have a 3-day red trend in lab turnaround time, but since September 4th, it has remained around a 2-day average. Regarding testing, we saw some consecutive red flags for the number of tests conducted, but overall, the number of tests conducted week to week continues to trend up. We believe the increase in turnaround time and decrease in testing were related to the Labor Day weekend. However, we are still concerned that folks are not getting tested when they should be, that they're avoiding it essentially. Because of those factors, we are representing this benchmark as yellow. Our third benchmark, sustained or increased public health capability. For this benchmark, we aim to initiate investigations for new cases within 24 hours and close contacts within 48 hours. We have added a few new team members into our EPI support team from last week. With this team, we continue to be able to initiate investigations in the desired time frame. And because of this, our benchmark continues to be represented as green. We will continue to evaluate this benchmark and make appropriate changes as the situation evolves. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. It also shows the additional surge capacity for these categories, as well as the COVID positive patients and the patients with pending test results in the hospital. These data are gathered from the information hospitals put in the Tennessee Healthcare Resource Tracking System, or HERTS. It may reflect Knox County, the East Region, or patients from other jurisdictions. During this time frame, we saw red and yellow flags noted for ICU beds and ventilators. 2 yellow flags were also noted for positive inpatients, but they were not on consecutive days. After speaking with our hospital partners, they stated that their benchmark should be represented as yellow. The hospital systems continue to meet regularly and assess the situation and plan their response together. As always, decisions regarding how to classify this benchmark as green, yellow, or red are made in concert with our hospital partners, as well as taking all of the data into consideration. Our fifth benchmark, sustained or decreased COVID-related death rate for identified positive or probable cases. For this benchmark, we use a graph that shows the reported deaths of Knox County residents by date of death. Over the past 2 weeks, we have seen 11 deaths. This information available leads us to represent this benchmark as yellow. And now we'll open it up for questions.
All right, as a reminder, you can submit your questions into the chat feature. The first question we have is from David with WBLT. It was admitted yesterday the 10 p.m. curfew didn't work. Why didn't the 10 p.m. curfew work, and why will the change to 11 p.m. work?
I'm a little confused by the question. If you want to provide some clarification, I think we meant the change last night was to go from a curfew to say so, but the initial wording of the draft document was for 10 p.m. closure, and it was moved to an 11 p.m. closure. I think listening to the discussion it was really about trying to find a compromise where we could allow folks to still have their business opening and operating, but also encouraging social distancing and all the things that we need to happen that is very challenging to happen in those social settings where people are drinking and will be less likely to be able to follow those 5 core actions. So it moved to 11 p.m. During the discussion last night. If you need additional clarification, please let me know, but just want to make sure that we're tracking on what you were asking about.
From Grace with WBIR, we haven't seen any inactive cases in 3 days. From our understanding of the state changes, shouldn't cases automatically move there after 14 days?
Well, but you're seeing new cases roll in, so we'll have to look at the data, but it could just be coincidence and things that are rolling in and cases rolling out at a similar rate. So we'll look into that, but from our perspective, I haven't heard any issues from our epidemiologist on how that information is being reported and what we're seeing, but we'll check into it and follow up and make sure there's not been an error on what we reported.
From Vincent with the Sentinel, the board went from a few weeks of not being able to reach a consensus on any new issues to a clear and concise safety message. You work closely with Dr. Buchanan. Do you have any insight on what changed between last week and this week?
You know, I think that there was a lot of things that went on. We've been seeing our data and it's been getting to be more and more concerning. And we've talked about that a lot recently. And we're seeing it in a very specific group of people, in age categories specifically. And I think coinciding that with the visit from Dr. Burks and the recommendations that she put forth, all really help to bring a cohesive message. I can't speak for the board. I'm just telling you my opinion on that. But I think that all of those things kind of culminated probably into them being able to land on the same message last night.
Also from Vincent with the Sentinel, what is the grand strategy for slowing the spread locally over the next weeks and months?
Did you say the ground strategy?
Grand
strategy. It's really, and I know it sounds like we repeat ourselves, but it's really doing everything we can to reinforce and encourage folks to use the 5 core actions. And social distancing and wearing a mask and not going out when you're sick and all of the activities that we have are surround those. And so closures that came from the Board of Health last night, that really is to try to keep people separated because those were the times and areas where they weren't. It also goes along with the 25 and under discussion and regulation that was passed last night as well. So I think all of it is really trying to make sure and reinforce the message of those 5 core actions and get everybody on board. I mean, the 5 core actions, that's the freedom to be able to continue moving forward and living our lives. And it's the balance that we have to play there so we don't have even more severe consequences if the virus were to run rampant.
From Jeff with WATE, Nashville is facing a controversy over whether COVID-19 cases could actually be traced back to bars. Mm-hmm. Can they be traced back to bars here? And does that controversy undercut the decision on the curfew made last night?
I don't think that that undercuts the decision made here. We've been very open and transparent about what our data has shown and the limitations of our data. And so we've never said that we've had actual cases tracked back to bars. What we are looking at and thinking about is the activity and the behavior in bars and restaurants and with drinking alcohol. And this is across the country. And so when discussions are being had on this, it's about saying that there are areas that have the regulations in place that limit those activities, and they have seen their numbers drop after those regulations have been put into place. That's what it comes down to. We've been open and honest about that. We know folks are going to bars and restaurants. We just haven't had any clusters identified there. And a lot of times we talked, I believe in the last Board of Health meeting, not this last night's, but the one before, I talked about this a little bit with Dr. Shamia, who asked about it. It's challenging in that the information that we have to associate clusters is as good as the information we get. And you're not necessarily knowing the person who's standing next to you in the bar and all of those things to be able to tie specific cases. But we do understand behavior and disease transmission. And that's where these decisions are the recommendations are coming from. And I think where decisions are being made based on that.
Grace with WBIR, I guess to add on to her question from earlier, she says the total active has changed, but not the number of new inactive cases.
Okay, I'll have to go back and look at that. It's really hard for me to answer detailed data questions when I can't look at it. So we'll follow up with you, Grace.
And then also from Grace with WBIR, have we seen cases connected to bars in our area? Help us understand why stopping alcohol consumption at a certain time can stop the spread of COVID.
We have, I think I just talked about that. We have absolutely had cases that tell us that they are going to bars and restaurants and doing all those things. When we've talked, we've said that we have not had specific clusters get associated with it where they say that was the only place they've been, that they were congregating with a lot of different people, that they can name the people. And there's challenge behind that. But we do absolutely have people that are doing that. And again, I think my previous answer, I'm not going to go into that again, but it's really about behavior and the way this disease spreads from person to person that is informing the recommendations that we're making. And this is happening across the country in various areas.
From Vincent with the Sentinel, we heard discussion about framing progress during the pandemic in terms of clearly outlined incentives, restrictions, openings, and measures of progress. That sounds like the phased reopening plan we had earlier. If this potential plan is different, how is it different?
Was that in discussion last night on the Board of Health meeting? that where he's coming from for that? I'm not really sure what you're referencing, Vincent. If you can give us a little clarity on that. I honestly wasn't at the whole Board of Health meeting last night, but we are following the Tennessee Pledge right now, in addition to the guidelines that the Board of Health have put into place where they differ. And so if I just need a little more context, Vincent, and I'll try to answer your question.
From Grace with WBIR, last night, Dr. Buchanan talked about recent growth in cases ages 14 to 22. Can you elaborate more on that trend?
That is the trend. And I don't know how we can elaborate more other than to say, by far, that's our largest growth categories. Really the 18 to 22-year-old group is by far the biggest. And I think it just is an undercurrent of all of the decisions and the discussions that you've been seeing recently, and trying to curb the spread there. While they may not have a lot of negative health consequences, the more that the disease is in the community, the more they'll come into contact with people that could potentially end up having all of the negative health consequences we've been talking about and worried about. So we really need to do everything we can to try to contain the spread of the virus. And right now we're specifically been focusing on that age category.
From David with WVLT, to follow up on the inactive question, the inactive cases has stayed the exact number at 6,892 with no changes for several days. Has any data reporting changed?
No, the process hasn't changed. That's why I said we'll go back and look at that, guys, and follow up and get you an answer if there's any issues. But the way we are pulling the data has stayed the same.
From Jeff with WATE, KPD says it will enforce the curfew. How will that work if a violating business is in the county, not the city?
I think that's a discussion for the sheriff and those folks as well. I can't speak to what they're going to do, as they made it very clear last night. The board can set the regulation, but law enforcement gets to decide how and when they enforce it.
Jeff's follow-up questions are, will the health department still try the education first approach?
That's always what we do before COVID and after. It's what we will continue to do. And so we will continue to do that as we have always been.
And his other follow-up question is, tell us about the discussion underway with the Knox County Sheriff's Office.
I believe all of this just happened last night. We haven't had a follow-up conversation with them at this point today. I believe that Chief Thomas said that she was convening that group to talk about how the law enforcement folks were going to work together last night. And so I would direct your questions to them.
From Vincent with the Sentinel, how long do you expect to see the shutdown lasting here before the county can fully reopen?
So the enforcement last night, it's not a full shutdown. It closes at 11 p.m. and I believe it was put into play for 28 days. And so it will be reevaluated then. And hopefully we've seen an impact at that time, and the board will reassess it and make their determinations at that time.
Also from Vincent with the Sentinel, what do you think of the county mayor being the lone vote against the safety measures?
You know, he comes from his perspective and his background, and that's completely up to him to be able to express that and do that. That's one of the great things that we have in this country is, and one of the, I think, benefits of the board is everybody has a voice on the board and can be heard, and he has every right to do that.
From Grace with WBIR, last night, Mayor Buchanan said Knox County is now in the red zone. What does that mean?
I believe she was referencing the White House task force reports that come down, and that one had just come out late yesterday that we received. And so those get updated on the TDOT website, not the full report, but the categorizations. But that just means that we have a higher rate of new cases than we had before. And I think that was referenced and discussed. I don't want to give you the exact details wrong, but we can give you the details of what the difference is between a yellow and a red. But essentially it's related to the rate of new cases per 100,000 of our population.
From Vincent with the Sentinel, he, I guess for his previous question, he says he is referencing the Board of Health meeting last night. And then he also says he is referring specifically to discussions about reopening plans in West Virginia that were discussed as potential models by the Board of Health, because these reopening plans outline epidemiological markers of progress that are
Gotcha.
linked to either implementing restrictions or lifting them.
Okay, I got you. Oh, and what in the original question was, where are we with that?
The original question, I'm scrolling
Sorry.
back up, was discussion about framing progress during the pandemic, restrictions, openings, measures of progress.
Thank you. So as a team, we're going to be talking about that, and we'll bring a example and options to the board for discussion of what that can look like. Dr. Buchanan gave some examples that we had received from West Virginia, that and then the Tennessee Department of Health had given some suggestions as well. So our internal team will look at that first, and then as they get recommendations in place, we'll bring them to the board.
From Grace with WBIR, we know it's early, but any tips or warnings of safe Halloween activities and or trick-or-treating?
The 5 core actions will come into play definitely there. And, you know, I honestly haven't even been able to get to processing that far out. I'm happy to think into next week, much less next month. So we'll start looking at that and talking about what our recommendations as a community will be, and as an organization will be for the community. But as always, they will be based in the 5 core actions and how best to keep folks safe and limit the spread of disease.
From Grace with WBIR, last night Dr. B mentioned KCHD staff have been in tears because of the way they're treated while trying to enforce regulations.
Mm-hmm.
What kinds of responses have staff been subjected to?
You know, it runs the gamut. So we've tried really hard to be positive when we're here and speaking and about our staff and the community in general. And most folks are easy to work with and are kind to our staff, but there has been a growing sentiment, and it's from the staff that are going out and enforcing regulation to the staff that's doing contact tracing and working our phone bank, of people that are just really, really angry and saying some very vicious and hateful things to our staff. And it's challenging because this is day in and day out and it doesn't stop. And we haven't wanted to complain, but we think that it's important that you guys know the reality of what we're dealing with, and to know that our staff, from the regulations side to the people that are doing contact tracing, are doing their job. And this is a job that's been done in public health long before COVID-19. It's how we didn't have a huge measles outbreak a few years ago. I think it's 2 years ago when we had some measles cases. We did all of the same things on a smaller scale. It's how we don't have tuberculosis rampant across the country. We do these same things when we have those cases, again, on a smaller scale. And so they're doing their work, and they're doing the work that people are asked to do in public health across the country every day. And there's just a more of an undercurrent of anger and just being kind of hateful to the team. And it's very challenging when you're having to do that day in and day out for them. And it makes coming to work difficult a lot of times, and we worry about them. And so I won't get into specifics of some of the things that have been said, but if you can imagine the worst, we've probably heard it.
From Vincent with the Sentinel, he's referencing his earlier question about plans.
Yes.
Can you clarify whether the 11 p.m. closure time expires in 14 or 28 days? The measure said that the sunset time was October 1st.
The closure is 28 days, I believe. We'll have to go back and look at it. We'll correct this if I'm wrong, but I believe it was the closure was for 28 days and the 25 regulation was for 14 days.
From Jeff with WATE, the White House task force report put Knox County in the red zone, but had Knoxville in the yellow zone. Any way to explain that discrepancy? I'd
have to go back and look at that. I thought it was the entire county was in the red, but I'll have to look at the details of that. It could be they're looking at the overall rate in the population, and there's population differences obviously between the city and the county. So we'll have to follow up with you on that question. And yeah, we don't track it that way. We track the county. So that's why I'm having a hard time answering that question.
All right. Any other questions? Please go ahead and submit them now. Not seeing any other questions come in. So thank you all for your time, and we will see you again for a media briefing next Tuesday. Have a good rest of your week and a good weekend.